This is a Second Opinion Sports Medicine podcast. I'm Dr. Dhokal. I'm with my good friend
Dr. Dustin Glass.
Dustin. How you doing today, man? What's going on?
Doing well. Another Monday here. And yeah, it's always fun. Mondays are good because one gets the week going, and then I look forward to either meeting in person or hitting a Zoom. But either way, I kind of look forward to the end of the day meeting up with you. So
Good. Yeah,
here we
same.
are.
I didn't tell you I was going to hit record. I just wanted to get started and jump into it. So I didn't mean to catch you off guard.
No, it's good. We're here.
How was the weekend with the family and watching some games? We had an update from last Monday's major injury, as you know.
Yeah, we'll get into that and talk about that. Had another well, softball started this weekend for me.
Yeah.
So now it's always kind of interesting. Fantasy, I got my fantasy football, watching the live games on the cell phone while I'm at the fields, checking my scores, checking my players, and watching some softball at the same time. So it was a busy Sunday, and yeah, got home and tried to catch a couple games. One game I did get to see that I was looking forward to the Jets game, and I forgot. I didn't forget, but I was still excited to watch the Jets, thinking Rodgers, right, the whole time. And so even though I knew he wasn't going to be there, I still was hoping to see him out there, which I knew it wasn't going to happen. But there was somewhere in me that, really is still bummed that he's not going to be playing that.
No, the hype is real for sure. They had Hard Knocks with the Jets, and I think there was a lot of people looking forward to seeing Aaron Rodgers play. Unfortunately, fourth snap, he went down last week as we were recording our podcast. And at the end of it, they said x-rays were negative. So that was pretty quick to get some imaging done. Of course, that checks bones and not ligaments. And later they did the MRI, which confirmed an Achilles tear. What was your thought when you first heard about that?
Yeah, well, as soon as we knew that, we were talking on our podcast as it was happening. We were even checking the phone during the podcast, and we were talking about, glad it's not an ankle. We had not really seen it. You had briefly seen, what it looked like, and you knew something was up. You had made a comment. You knew the way it had happened, and the way he responded, you knew something wasn't good. And we were talking about speculating on the frustration of how it all went down but then got in the car and turned on the video and watched it happen, and you can see it just explode like that. I instantly felt for him. So what about you?
I watched it again. I saw it for the first time right before we were about to record. And so it was just my first reaction to it. It did kind of take me aback that he had this reaction that seemed just different. It wasn't like you turn an ankle, you kind of hobble it off, you try to walk it off. He was kind of like sitting and very calm. It kind of reminded me, not to run analogies, but it reminded me a little bit about his facial expression, reminded me a little bit about how Kobe looked when he tore his. A little bit disbelief, but also knowing like, hey, this isn't something normal. This is something serious,
Yeah.
So I just had a vibe, and then they must have known, as you and I know, you can do a test and you get the imaging to confirm with the MRI, but you have a pretty good indication, and they probably had a pretty good indication quickly.
Yeah, they knew right away. I'm sure it is one of the more painful. Right away the difference. I've had a partial tear, and I thought it was a complete tear. That's how painful it was. I can't even imagine a full tear. So when you felt that pain and you saw the reaction, saw what was going on, I'm sure you've heard your patients describe it, and it's actually true. You feel like you got hit with something in the back of the leg.
Sometimes people say I got shot with something.
Yeah,
it felt like I got shot.
That's what it feels like. I was at a softball game. I was coaching first base, and there was a ball thrown from third, and I was getting out of the way, backing up, and I felt like somebody hit a rogue softball, and it hit me in the back. Other people said it felt like a golf ball hit back, and that's exactly what it felt like. I turned and looked. I thought from another field somebody hit, a foul ball that hit me in the back. That's exactly. And then as soon as you go, the pain is real. And then as soon as you go to push off on it, that's when it sets in. It's not working, and that's what Aaron Rodgers. That's why he sat down.
Yeah.
There's nothing you can do when you've torn that. So
Look, he was stoic to me, like, really quickly when I tore my ACL, I tell people before I hit the ground, I knew it was all bad. And so to me, he was so stoic, and for someone who's such a competitor, and you knew he was going to a new team. And I also thought it was awesome, his reply. He said, something along the lines, the very end of it, he said, "I'll be back." But his quote was, "Thank you to everybody for the well wishes, and thank you to all the naysayers and the people who speculate, but I'll be back." And so that gets me to what I wanted to actually talk about, was this Achilles surgery. He saw a doctor that saw Tom Brady for his knee surgery when he got hurt. I forget what year that was, but over a decade ago. And then apparently he was Kobe's doctor as well for his Achilles. And I know you knew him at that time. Tell me about if you have heard of Dr. L. Aldridge. Is that how you pronounce his name? How do you say it? Elatraj.
Yeah.
My apologies.
No. First time I met him was Kobe actually introduced the two of us.
Gotcha.
And so we worked on a case together many years ago. Kobe wanted me involved with something that Elatraj was helping him with. So he tied us together, me doing the rehab, him doing the orthopedic side. And so that was a lot of fun working with somebody. I mean, even Aaron Rodgers, I think, or somebody mentioned that they called him the GOAT, right? As orthopedists go, they call him the GOAT, right? His track record, his resume goes so deep with so many athletes and entertainers, that to be able to work with him in some small capacity. And then years later, when I got the job with the Dodgers, right when I walked in, he was in there. We were working together in the medical of the Dodgers too, which was a kind of a reunion, because before, when I was working with him, or co-managing a case, I can't say I was working with him, but we were co-managing things like medical providers do, through text, through email, whatever. We even talked on the phone at one point, but and then to meet, you didn't meet in person. We're distance, LA, Orange County, but then to be in the same office as him and being a peer was pretty cool. So yeah,
that's awesome.
So I've had some contact with him, and he's an unbelievable guy, unbelievable doctor.
So what's his specialty specifically?
Well, orthopedic, he elbows, shoulders, knees.
Gotcha.
Those are primarily, what he's known for. I'm sure anything he can get his hands and scalpel on, that he'd be good at, to be honest. But those are kind of the ones I know through athletes that he's helped with. So I think that's what, when you, just like Rodgers, he knew he did Kobe's and he saw what Kobe did, right? So Rodgers who's the best out there? I want to team up with that. He's already seen the results. So he gets those calls. Tom Brady, okay. There's these guys. Yeah. It's not hard to pick up that phone and say, I want him. So
well, word spreads too. You build a reputation and you have success. Word definitely spreads.
Well, he did Otani's elbow too in 2018. So, there's, it's a
who's who.
Fraternity of,
yeah. Well, with this particular procedure, Dustin, he said that, or I read, I should say, that it's a speed bridge is what they called the surgery, that type of particular surgery. And it's designed to accelerate like the normal rehabilitation process of the injury, to accelerate that. And, you probably already read that Rodgers was, saying, I had the surgery done, this innovative procedure, and I'm looking to come back sometime in the playoffs, which most people wrote him off for the whole year. And I never like to put limits on people, especially when it comes to rehab. And, it might not work for you, but who's to say it won't work for him, And so I'm excited to see his recovery process. And I wanted to ask you if you've heard of that particular type of surgery, the speed bridge surgery.
No, I haven't heard of that. I'm going to look into it now that you mentioned it. I know I call it lucky and fortunate.
Sure.
I love those cases. So I've been lucky enough to be called upon to work a number of Achilles injuries, and I like them because they're not easy to rehab. You got this. The reason the Achilles takes so long, as you know, is because there's very little blood supply going to that tendon. So for those that don't know, you have the tendon comes off of two big muscles, the gastroc and the soleus of the calf muscle. So two huge muscles of the calf come down into this tendon, attaching onto the heel bone via this tendon, the Achilles tendon. That Achilles tendon has very little blood flow, and at the area that it tears the most commonly is very little blood flow to that area, even more or even less blood flow. So it makes it, if there's less blood flow to begin with, it's easier to tear. And then that's why it makes the rehab so much harder, because you need blood flow, oxygen, nutrients to be delivered to heal them quicker.
Mm-hmm.
So I haven't. So in my past working with them, I was introduced from some orthos about several types of tears, a couple of different tears, horizontal or vertical, and they recover and rehab differently. So it'll be interesting with that technique. When would you use the technique on horizontal, vertical, whatnot? So
What's interesting is it says, when I was reading it, there was an article by Ian Rappaport on SI.com, I think it was, and he said the speed bridge does not guarantee a quicker return. It's designed to enhance the strength of the repair and guard against stretching, right? So then that makes sense on, if you have a normal repair and during the rehabilitation or the healing process of it, that tendon seems to stretch a little bit or get loose, that could be problematic for a high twitch athlete or somebody looking to return to play quickly, where there's crazy shear forces and demand placed upon that ankle, more so than the normal person who just wants to walk up and down stairs or get in and out of his car.
Correct. Yeah. Yeah. So that'll be interesting to see. They have to immobilize it. I think you mentioned something about the fibers and lining them up, and that's the critical part. It takes up to 12 weeks, 12 weeks of healing that tissue. And the way the tissue lays down, it's just a mix match of fibers going in. We need to get those nice and smoothed out and elongated. So I'm thinking that's what it helps, with that. So on the back end, when we start doing soft tissue, it's that much quicker.
Yeah, they're targeting 4 months. So I think that's amazing, because it used to be maybe you can come back, return to play next season or a year, So it says the speed bridge is a new procedure which, if successful, could return Rodgers to the lineup in as little as 4 months. The expedited timeline would give Rodgers an opportunity to play, say, mid-January, if the Jets were to make it that far. So I think if nothing else, it's inspirational for the team to continue to work hard and play hard, thinking like, hey, if we can get there, then we might be able to advance further.
So one thing I'm interested in, you said if nothing else, it makes for an interesting story, to see his comeback. And one thing, if nothing else, he'll be able to come back. And the biggest thing is because he needs to be able to push off on it. He needs to be able to have strength and have the power with it. I think he's got such a big team around him to get him. If anybody can do it, it's going to be him, with his mindset. He's already set the tone that he's going to be back, and he's going to be back quicker than they expect. That's half the battle, in my opinion. We talk about the mindset all the time. He's setting the tone right now. He's setting the expectation. And I know personally that through our network that he's got a hyperbaric sent to his house already. He's got the same hyperbaric that I use in my office. He's got it sent to his office or to his home. And if he's getting in that, which he is, delivering tons of oxygen, he's giving himself the best chance. And if it's me and you, I know 100% we'd be using PMF, pulse electromagnetic field, using our modalities to deliver everything that you can deliver oxygen to give it a fighting chance. Then it's up to how fast his body's going to heal. But hyperbarics, PMF. I use a transdermal cream too that I get from a compound pharmacy that helps deliver, especially in hard areas like that. That uses L-arginine, L-citrulline, different things to help vasodilate and bring in more blood flow and oxygen. He's going to have access to all kinds of stuff like that.
I might need some of that for my back after golf.
It's good stuff. I'll put you in contact with it. But another thing that I would make a note on, and I think you'd be on board. Well, I know you would be. One thing that I see get missed with Achilles recovery is everybody goes right to the Achilles, goes right to the heel, goes right to the calf. All the work's done on that. Like we've talked about before, you got to work above and below. I would definitely go to the popliteus, the tib fib, work sartorius, work TFL, and get the tension off that knee area. Get the tension, get the mobility of the foot and the toes. Keep mobility in those because he's going to be locked up for a while, and then everybody's going to work on that calf. But if you don't have mobility in those toes and you're not working those lumbricals, dorsal interossea, all those tarsal bones, you're going to miss. It's going to take that much longer. So I'm hoping
all of it.
Yeah, I'm hoping he has and I'm sure he has a staff that's super knowledgeable about that. But that's where me and you get called in a lot of times because we look outside the box. How many times are you working with trainers? And it's not that they don't know. It's just that's what they're trained to do. PTs, trainers, athletic trainers. For the majority, let's go and rehab the tissue and let's strength. They're really good at strength and conditioning. We're trained at the joints and keeping them mobile, right? And so that's what our specialty is. So the combination of the two takes it to another level. That's how we see the Kobe's get back. We see the Brady's get back. We see all these guys. They have teams that work at the joints as well. So anybody listening that gets a Achilles issue, make sure that you're getting that done as well.
Yeah, it's not just
faster recovery.
It's not just the area of injury, right? It's not just that particular surgical site. And that gets ignored, like you said, often because the focus is that particular site. But just this week, I had somebody with an Achilles issue, actually. It wasn't an Achilles issue. It was Achilles heel pain. And his issue was, up the calf, down the foot, into the hamstring, and actually into the low back, where it was affecting what came first, the chicken or the egg. His hip was locked up and rotated and elevated, and his right lumbar spine all the way up the right side was really locked up, almost rotationally, but compressed as well. So it wasn't just that heel, it was all along the right side. And as I was working on him, I said, well, if we can free up a centimeter here, half a centimeter here, that adds up. And so that could free up some tension. So that made some sense to him, even if it wasn't 100% anatomically what we were doing. He understood it and he felt better from it, So to your point, yeah.
Very cool, yeah. So, and no doubt, Roger's dad's a chiropractor. He's getting all that taken care of. So,
yeah, it's exciting to see that he has that as a target date, and I think he'll go into the back cave and quietly do some work, and rehab. And it makes me think of when Russell Wilson was injured, a hand injury, I think, or something. And a report came out. People like to make fun of Russell Wilson a lot, but a report came out saying that he was getting treatment on it 23 hours a day, and people are like, is he not sleeping? Like, that's not good for you. And it's like, well, you can passively still make improvement. You can be sleeping on a PEMF mat. You can be hooked up to, like maybe an ARP wave while you're sleeping, perhaps, or while you're watching tape. So you can continually be getting stuff, or you can have a patch on or have a different thing on that helps you. So I don't consider just actively working out as being rehab time or improvement time. And I think you feel the same way.
Yeah, I agree. That's one of the things we've talked about on the podcast, that 2-to-1 ratio, right? For every hour activity, half hour of recovery. That recovery doesn't mean, so if you're practicing 4 hours, you're not recovering for 2 hours straight. That means you're doing, like you said, 15 minutes here, 5 minutes here, 10 minutes here. Be on the PMF for 8 minutes, whatever. While he's sleeping, he could be listening to binaural beats. That's setting his brain waves he's recovering during that time.
Sure.
So when people make fun of it, it's like they just don't understand.
You just don't know.
Yeah, they're ignorant. So,
well, I think, you want to maximize. There's only so much time in a season, and there's only so much time Sunday to Sunday, and everything is so regimented and everything is so calculated. There's only so much time, right? And so you want to maximize the time that you have off the practice field, out of meetings. Sometimes it's while you sleep, sometimes it's while you travel,
Yeah. Well, that's why I'm stoked. Like, okay, when you have an injury like this, and you've had injuries where one of the most frustrating thing for these athletes is not doing anything, right?
Correct.
And especially right after surgery, there's this period of time where you can't do anything. You have to let it immobilize it, right? To allow it to mend. That drives athletes crazy. That drives people that are active lifestyle crazy, because their mindset is go. If I'm losing time, somebody else is working. So that's why I love PMF. That's a passive modality. You can do it right the hour after surgery, the minute after surgery. Right. You can jump in hyperbarics right after. You can be doing all these passive. You could do LED, far infrared. You could do, cold laser. You could do. There's tons of modalities that you can do. That's how these athletes get back so much faster, is because they're doing passive type modalities that don't require movement. You can't do ultrasound on an acute condition necessarily. You can't do electrical stem necessarily. With the arc wave you can on some acute condition, but if you don't want a contractile tissue on something, then you have to have passive modality. So right. I don't know where I was going with that, but
no, it's just I think you were answering the question of like, man, how is that possible? How do athletes get back so quickly? One is it's the sports medicine, and two, it's they're phenomenal specimens, as far as they take care of their body for a living, right? So they're in exceptional shape, and their mindset's different. And so I think all of that matters. Your mentality when you have an injury, the work that you're putting in physically, the nutrition that you're having, the sleep that you're getting.
Yeah.
I mean, those are all critical factors.
Yeah. And like a lot of people will come back with an argument, well, of course they get back so much faster. They have access to all that. They have the money for all that. Well, me and you are accessible, right? And I'm not trying to drum up business. I'm just wanting people to hear, like, you can have these type of care. It doesn't have to be thousands of dollars. We know tricks and modalities that you could do relatively for free or very inexpensive, that you can start accelerating quicker too. So the answers are out there. You just got to seek them out.
No, for sure. And I think in almost every major city, at least, there's people who practice the way that we do, with the same philosophy, at least. And it does take work, though. It's no different than if you're looking for somebody that your insurance covers. That's a lot of work, whether it's for a general practitioner or a therapist, or, you're looking for where to go for rehab or physical therapy. So it does take work, but it's worth the effort, is what I would say.
Yes. Agreed.
I want to bring up one of the most wicked hits that I've seen all season long, and it wasn't in the NFL. It had to do with the University of Colorado and Colorado State college football game. Did you happen to catch that or catch any highlights?
I did not, but where was I? I was somewhere I was talking with the coaches at my daughter's game, and they had seen the game, and they were giving me recap, and they said it was one of the most brutal games. It looked like a street fight out there. Colorado State they had a mission. It sounded like they had a game plan that they were going to execute and hit harder and hit first, strike first type thing. Sure. I don't know. I didn't see it though, but
I would say yes. I would say watching it definitely seemed clear that the coach of Colorado State, to me at least, told his team, we're not going to get pushed around, and I felt like maybe it became more of a coach thing, because he made a comment about Dion and how he took his press conference that he was in a hoodie and sunglasses. And so that's a little bit unusual, maybe coach to coach. They're both young coaches. Dion comes with a lot of recognition and press. the couple times I met him were just in passing, and he was super nice to me. So I think fondly of him, even though when I met him the first time, I said, man, I think of you more of a Cowboy than when you were with the 49ers, you know? And he said, I won a championship with both. And I was like, damn,
Oh, yeah.
that's real. But yeah, he comes with a lot of attention, right? And so for whatever it's worth, to answer your question, I felt like Colorado State was a little more chippy. There was a little more, just a half a beat, late hit, just some extra stuff. The hit I wanted to speak about was to Travis Hunter, their kind of both way player, right? So he plays defense, he plays offense, receiver, and he had a sideline route. He was running, ball bounces. The guy takes like 2 steps after it bounces and gets him right in the chest. So it kind of looked like maybe he just knocked the wind out of him. It was enough to decleat him. He's a big boy too. He's a big kid. Plays most of the snaps. Clearly, like the star next to Deion Sanders' son, who's the quarterback, and it knocked him out of the game. Later on, they said he was taken to the hospital. The player who did it wasn't ejected. He got a penalty, of course, but wasn't thrown out of the game. And later it was reported that he had lacerated his liver and he's going to be out for a few weeks. Next week, University of Colorado plays Oregon, probably their biggest game yet. This game was a battle, Dustin. It was back and forth. It went into OT. University of Colorado was favored by 22-23, and they barely won.
Wow.
But I would say it was a scrappy, like street fight type of game, you know, like it was man, I wish you would have seen it, because you would have said it was probably the most exciting college game that I've seen thus far this year.
Yeah, that's what I heard. I mean, the play-by-play, the blow-by-blow, some of the recaps, especially the way it ended too, sounded kind of controversial, or could have been on a PI, or I don't know if it was a PI, you know, or what happened, but it sounded like there was even that could have gone the distance. Do you recall? Or
Well, I recall Colorado State getting the ball after, or University of Colorado getting the ball after Colorado State punted, and University of Colorado took the ball at the 2-yard line. So Colorado State's punter kicked that thing and it just died at the 2. So here you take over, and Shadur Sanders, Deion's son, led that team 98 yards, and they scored a touchdown and got the 2-point conversion, because it was in the second overtime. So you have to go for 2 in college football in the second overtime. You can't just be kicking extra points. Makes it a little bit harder, of course. They asked him about that afterwards, and he said, I was just thinking I got to Brady it. He said, if he can do it, I can do it. And the reporter said, well, don't you know him? And he goes, yeah, there's probably text messages from me right now, from him right now on my phone. So I thought that was pretty neat as well.
Yeah, well, that's pretty cool that in that moment he dove into his thought process and had that thought, like, hey, if he can do it, I can do it. You know, that just doesn't come. You know, they've had talks, right? You know, and he's seen that, he's played that through in his head many times.
It's a mindset. Yeah. And you know, I think as a quarterback, just like as a basketball player, you think 3, 2, 1, game winner. You know, I think as a quarterback, you think, okay, 2 minutes to go, 1 or 2 timeouts. I got to go 80 yards, 90 yards to win it. So as a kid, you go through those scenarios, and he had the GOAT coaching him and giving him some words of wisdom. Plus his dad's Deion Sanders. That's another level.
Yeah.
But you know, I feel for Travis, who is going to be out a few weeks, and I think he was a big part of their offense. You know, University of Colorado traditionally hasn't been a big powerhouse, and now they're making noise. I read that their last game generated something like $18 million for the surrounding college town, you know, so a lot of press. It was on ESPN. I'm telling you, it was an exciting game.
Yeah. Good for them. Good for the state. Good for them. That's exciting.
What do you think about the lacerated liver? I've had a player before who's lacerated his kidney and missed a few games, but I've never heard of a lacerated liver. Any thoughts on that?
Yeah, same. That was the first thing, you know, when I heard about it, came to my mind was, okay, I've had kidneys. I've had, you know, patients with kidneys, never the liver. So I kind of did a deep dive into that quickly. I guess it wasn't too much of a deep dive, but I did look into it.
Yeah.
And yeah, but they could actually go in and suture it depending on how, lacerated, or they just let it with bed rest, depending on how
Heal.
bad it is. But either way, that doesn't sound good or fun. It sounds painful,
Yeah.
so.
Terrible. Think
But
of like,
they're pretty common. I did read, like, in car accidents, it's that blunt force trauma to the chest, and that's what it sounds like. You saw the hit. I didn't see it, but
dude,
so that's a hard hit if you to be damaging organs, right?
if we could somehow edit that into this, it would be, it would do it justice because it was pretty savage. It was full speed, it looked like left shoulder of the safety into, I mean, the receiver gave up. The ball went over his head and bounced. So he wasn't like running and tight. You kind of, let up. And so it looked like he got really run into when he wasn't expecting it. And I kind of thought it was a dirty hit, to be honest, too. Like it was unfortunate.
Yeah, so his core wasn't even engaged at all. I
I
mean,
don't think so.
yeah.
No, but you're right though, because I think if you're, expecting it, if the play's in play, then you're an athlete, you're expecting something and you're different, you're guarded, you're a little more, have a little more hypertonicity, you're a little more, rigid, so to speak. And so, man, it was savage. Like I said, I think it was the hit of the week in NFL and otherwise that I saw personally. I'm sure there were other ones, but it was aggressive. So hopefully he comes back. I'm sure they have, everybody, and Dion has every access to medical care and health. And so I wish him well. I hope he's back soon.
Yeah, me too. Speaking of injuries, and you just mentioned you thought that was one of the harder hits you've seen. Talking about NFL, let's get back to some NFL talk.
Yeah.
What about some of the more impactful or serious or injuries that you might have seen come across your desk this week or since yesterday?
Yeah, football. So there's football and non-football related. I'll start with non-football and then I'll get your thoughts. Ohtani being out with his oblique injury, that's significant. I think he's one of the best baseball players in the league, and he's right in our backyard. You probably have some experience or stories with him, perhaps. There's another pitcher, speaking of baseball, a Yankees pitcher who took a baseball to the face and fractured some facial structure, facial bones, had a concussion. So that was pretty aggressive. I watched a college game, University of Florida, defensive back, running into the end zone, making a play on the ball, and his knee hyperextended when he planted. One of those that I know you've seen before, Dustin, where it was just hip thrust forward, legs locked, foot stuck in the ground. So hopefully he's okay. Number 8, his name's Kimber. He limped off the field. They were going to do some imaging, and I haven't heard anything new about it. So were you aware of any of those before I go into the NFL one?
Well, the Ohtani one, like you said, it's in our backyard. He, before that, he had the elbow too.
Right.
So within the same kind of week. But so I always like to think, okay, chicken or the egg, like you said, elbow, and then he's got this oblique strain. We don't know that we're not talking about the details of it, but if you're dealing with a possible UCL injury, and he, like I mentioned earlier that he had UCL surgery done in 2018. So this, and that one those take a while to get back to
part of the season.
Yeah. So luckily and unluckily, but that was during COVID. So he was able to have some more time, but it wasn't until 2022, I think, that he actually got back to throwing full speed and game ready to his full capacity. So those things take some time. So it's unfortunate that he's having some issues again, but he's one of the most dominant pitchers and hitters in the league, and if not in the history of Major League Baseball. So having that oblique is involved with hitting and in pitching, and he's the best at both. And so the oblique, it's kind of interesting. My thought process is on his pitching, because part of that part of the pitching mechanism, when you're coming back, you're extending, and that oblique is eccentrically helps protect from that hyperextension in your windup. So, if he was dealing with that UCL and he was having to gut through it a little harder, did that maybe,
contribute some way?
Yeah, in order to throw harder, you wind up harder, right?
Sure.
So if he's winding up harder and his back's going into hyperextension, those obliques are going to have to work harder to protect it from doing that. So it's kind of interesting from a sports medicine, biomechanics thought process to kind of work that backwards. Again, we don't have all the details, and nobody's going to start really trying to speculate, but after his recovery, and part of his rehab is going to be able to figure out, okay, how do we protect this from happening again? Let's make sure we're not having the combination again.
Yeah, no, I think that was well explained. That's really how I try to break things down as well. And going back to that kind of Achilles pain, heel pain that patient had, I got up into his low back and he's like, it's the heel, right? I said,
I love that
yeah,
one.
but how does this feel? And he goes, that doesn't feel good. I said, yeah, well, that's, so I explained what we were doing there. But yeah, I think the same way, it's hard to say, but I think the higher level athlete you are, the more fine-tuned you should be in your rehab approach and in your thought process to your rehab or your preventative. Forget the rehab. I think we're really good at rehab, but what I feel like I'm better at is preventative, and like figuring out what weaknesses are and what we can do to minimize those, to minimize the chance of getting injured in the first place, right?
Yeah.
But the way that you broke that down, I really liked it, because there is a correlation there, and it's kind of like a domino effect, and we won't know because I didn't have my hands on him and I don't have any inside information. It's a moot point really at this time, but that does lend to kind of our thought process.
Yeah, it's kind of fun to talk it out loud, just let people inside our heads, but that pitcher too, I watched that video. I don't know if you saw that video, but he took 100-mile-per-hour ball to the head, that's coming quick. He had no time to really react, and it ricocheted so hard off his head, it went into right field. I mean,
lucky to be alive, if you ask me,
Oh my gosh, so scary. So I think we're seeing more and more of these pitchers getting hit. The reaction time, you're going to have to start training reaction time, or something. Something's got to change. They're going to have to wear masks. They're going to have to wear something. I mean, in softball, most pitchers all wear a face mask, to pitch. Because it's a closer distance, and I can see the transition. Some of these pitchers will start wearing them out of necessity because they had facial fractures or whatnot, and they want to pitch sooner. And the doc says we've seen it in basketball. They wear the clear, face guard for their nose and cheeks. So I'm sure baseball, and I think we've seen a couple people do it, but I think it's going to become more like what you're saying, more preventative. Don't wait till it happens, because it could kill somebody.
Yeah, it's surprising that it doesn't happen more often. I'm always super surprised when that ball comes back and they catch it for a line drive out.
Yeah.
That happens even more often than when they get hit. So instinctually, it seems like they get out of the way somehow most of the time. But look, if I got hit in the face once and I had some previous fractures, you better believe I'm wearing that mask from then on. I don't care what it looks like.
Yeah.
Maybe I don't wear it if it's never happened to me before. I might give myself that one time, but honestly, it hits you in the wrong place. No over dramatics there. It could take your life. That's serious.
Lights out. Correct. Yeah. So you had mentioned, let's talk about prehab or preventative stuff too.
Sure.
You had sent over lineman, and now it's escaping my memory, where left tackle. Do you remember left tackle?
Yeah, you're talking about for the Vikings O-line?
Yeah. Yep.
Yeah,
exactly.
number 74, he's a left tackle. Udo is his name.
Udo, yeah. So looking into that. So that's a quad tendon tear. That's we
both know somebody that's had that.
Yes, that's correct.
Yeah. So our good friend Corey Leggett was on our podcast a few months ago, and Had the pleasure of knowing him for a while. He's had 2 quad tendon tears, so pretty significant.
Yeah, he spoke on that. So for those listeners, go back to listen to those episodes if we have those archived.
Yeah, we do.
Yeah, but talk about that quad. I was looking into that to try to see what was going on. So he wasn't even the starting left tackle for that game. So kind of interesting. Go back into a sports medicine mindset. You always want to look. How did this happen, right?
Right.
Well, he was the second string. The first string in warmups had a reoccurring ankle injury that kind of flared up. So they took him out. And now this guy that probably didn't think he was going to play is now thrown into it, right?
Sure.
And now, hey, you got to perform. So could have been prevented. What did he do for warmups? Was his warmup on point? It's all these kind of things from a sports medicine side you start thinking about. I'm sure he's a professional athlete. Every game you're supposed to go into with the mindset you're going to get in. You got to be ready. Your time's going to get called. I'm sure, and he's not a rookie. So
I would say it's not even the preparation, although you're right about the preparation and the mindset for sure. But it could just be your body's, how used to it is to that type of impact and intensity. You can go in practice against the ones. That's different. I don't care how intense it is. You can go and have a team versus team co-practice like the Chargers did against, I think it was the Saints this year. And, that's a little more intense than when you go against your own team, but it's just not the same in competition. It's not the same. So
you can't replace that. I agree 100%. That was and I was going to lead into that. So I'm glad you brought it up. That's exactly what I think. You can't replace those game time situations. You can be as prepared as you want. So you start taking, okay, was I prepared? Was I warm? Did I have enough reps in practice? Okay, I did have enough reps. Okay, so you take everything else equal, but you didn't have the game time situation, intensity, adrenaline. Those guys are bigger, faster, stronger, want to get past you and kill your quarterback. There's all those things those are the intangibles that, are very hard to replicate. So, and then, then who has to come in for him is the third string guy. Yeah. Well, that third string guy who is a veteran was just brought up and activated on the 30th of August. So how much prep has he had? Game time. He's a veteran. So, he's been there, done that. I got this. He's got his routine. I'm sure he's fine because he's had so many, but still now you're asking a lot of your body, right? So
no, it is.
It's just kind of interesting. A lot of people don't put that thought process into start thinking about all those other elements, right? So yeah,
that's good insight.
You just see left tackle out with a quad injury, and our assumption is the starting guy. It's like, oh man, but no, that's how the game works. It's a business.
Sure.
Now who's their fourth string guy? They just brought the third string guy up August 30th. So this guy's, he's now first string.
Let's keep an eye on it, because what happens sometimes there is not a fourth string, and now your right tackle might switch over and become your left tackle, or the guard might move over to replace somebody else, and so now we're playing musical chairs. And there is positional nuances, and I think that there's muscle memory in playing a position. If you're a left tackle versus a right tackle, your stance is different, your steps are different. It's opposite,
It's like riding with your left hand versus your right hand, vice versa. It is not easy. It's not easy. It's very hard. It takes a very athletic individual to be able to go left to right side, because especially at tackles, because of the pass protection, the guards and center, it's a little easier, but still not that easy. But those, those outside guys, it's a lot harder, and taking a game time situation. Let's think about this. Who do they play next weekend? Your boys. So,
I know, dude.
Yeah. So, okay. So, it's like you almost want to whisper in there. They know. It's not that we have to tell them anything, but listen, it's like from a coach's standpoint. So now we put on sports medicine hat. Now we put on coach's hat and says, okay, it's just like any, the DB goes out, and now you got this rookie DB in. Okay, let's go after him, right?
Yeah.
Well, okay, your left tackle. Now you got your third string left tackle that just got reactivated or got brought, in. So let's just our week is just go out.
Look, that game is going to be a knockdown slugfest as well, because you have two good teams that are both 0-2. It's in Minnesota. Their home crowd's going to be crazy. There's a stat about going 0-3 and making the playoffs, and I'll tell you, it's not good. And so we're looking to go on the road, we being the Chargers, looking to go on the road and get a road victory after two really good offensive showings and two not really great defensive showings. So to your point, they have a left tackle injury. They have a replacement there. Of course, more on the sports medicine side than the coaching side. If they attack that weakness, maybe you'll call it, on their offensive line, hopefully the Chargers will have some success against the Vikings. But from a sports medicine perspective or a doctor's perspective, you're really concerned about the attrition along the line and who may be, what I'd be looking at is the person who's now changed positions, and I'd be assessing their body for, imbalances, basically. Some imbalances are okay. You're a left tackle. I expect maybe your right leg and right IT band to be, and maybe even right lumbar to be a little tighter just from stance and from kind of how you contact people. Now you switch positions, you might actually have an imbalance that creates a weakness on the other side that was a strength on the other side, right? So that's what I'd be prepared for, is like, hey, let's make sure we have backups to the backups, because now there's a problem.
I'm wondering if we can re-sign Corey for a weekend. Let him loose. He can get the job done, man.
That'd be great.
Come off that left side.
Yeah. I think he'd say whatever that quote is I'm not as good as I ever was, but one time I could be as good as I ever was, or something like that. Yeah. Yep. For sure. I'd like to bring up a couple of NFL injuries before we take off for the week. One, unfortunately, was Cardinal safety, ended up on the injured reserve. Budda Baker hurt his hamstring significantly enough to be put on the IR. That just happened today. So that's unfortunate. He's going to miss a handful of games. There's a couple other people that have been on the IR due to a hamstring injury as well. You asked earlier in the podcast, most significant or most serious injury that I saw. I think the most impactful is going to be to the Giants. They squeaked out a victory. Their first 6 quarters, they didn't score any points. Then they went in at halftime. They were down 20-0 to the Cardinals, and they came back and won. What's the saying about winning the battle, losing the war? Well, they lost their star running back, Saquon Barkley. He had an ankle injury. They say he's out 3 weeks, maybe 4 weeks. What I thought was interesting was somebody from the front office, I believe, somebody from the team said that it was a quote unquote ordinary ankle injury. And I just thought that was like another level of like, we don't want to really tell you, so we have to say something. I thought, I don't think I've ever heard that before, an ordinary ankle injury. Have you?
No, I haven't heard that. I've heard a lot of, but that's funny because me and you will pick that up. Other people won't, but I mean, in the sports medicine world, we'll pick that up because we're thinking about those kind of things. But, I'm sure it's not ordinary to him either,
Yeah.
So.
Well, it's a contract year for him, and no one wants to be out. And, it's not like a week. It says it's multiple weeks. And so, yeah, best case scenario, it's less than that. He's doing all the things that we talked about previously. Worst case scenario, it's maybe a little more than they're letting on, which that's the nature of it. They're not going to tell you everything. And so I wish him best, but yeah, that's terrible. The other thing that caught my eye was Joe Burrow. He restrained his calf. You had brought him up in the preseason saying, oh, he's out. He might be out a couple weeks. Mm-hmm. And it looks like maybe he might miss time. It seems like it's a re-aggravation of something previous. Do you think this is going to be a problem all year long for him?
I think it's setting up to be, because knowing how those calves work, and if it's not healed, like it can get to the point, and this with soft tissue, we can get to the point where to the touch it feels good, to the heel walk, toe walk feels good, even jumping 2 feet, single foot, change of direction feels okay. But it's that game time, like we were just talking about, dropping back, pushing off, change of directions.
Yep.
what makes me nervous about it, the more it happens, the weaker it gets. Now we're setting up a neurologic pattern for weakness in it, where the brain thinks this is what it wants to do or what he wants to do. Calf pain, weakness, shut it down. Calfness, weakness, shut it down. And then it creates this pattern because that's what it knows right now, right? I know I talk about the brain like it's a separate entity, but if you look at the neurology of it, that's how we learn things,
Right.
and that's how we set patterns. It's the neuroplasticity, right? So it could be used for good or bad. So when we're seeing a recurring injury, that's why it gets me nervous when people go back too soon, or we hear, oh, I rolled my ankle and I've always rolled it. I've rolled it 12 times. Well, as soon as you hit that weird spot, your brain thinks that's what you want it to do because you've done it so much and you've never told it otherwise, right? So same thing with this calf. When we're seeing week in, week out, multiple times, like with Cooper Kupp's, hamstring, I'm a little nervous about that because he keeps coming back. It keeps happening. It keeps coming back, happening. Now it's setting up a pattern for that too.
Sure.
It makes it a lot harder. But, but I'm sure on his mind too, calf Achilles, quarterback Achilles. He's a little nervous because what happens, the way those Achilles tear is when your foot's in that goes from a plantar flex to a sudden dorsiflex.
Yep.
So which is
quick,
yeah, exactly. When you're already down and you wham, and you try to push off. So him and his team's got to be a little nervous, in my opinion, that that could happen to anybody.
Yeah, and part of it's, again, part of it could be coaching, right? If you're moving the pocket, if you're having that quarterback go out, or if he's mostly in the pocket, you may want to take out some of the, more plays that call for more mobility from him. But I was explaining to somebody about muscle memory, and I said, hey, it's not just free throws. Muscle memory can be negative as well. There's positive muscle memory, your golf swing, the formation on how you throw, how you shoot. But there's also negative muscle memory, and he said to me, and he's a high level athlete, come on. And I said, what's alligator arms? That's muscle memory of, oh, I got smacked last time I went up the middle. So now I know someone's coming. I'm trying to do this. And now I'm going to, because I know it's coming. There's negative muscle memory. And so I think with the Joe Burrow thing, hopefully it's not something that's reoccurring. But it's just tough to start the season out dinged up, because as anyone knows who's played football, it typically doesn't go away. You just manage it. And for a quarterback, that calf's important, just as important as the shoulder. You're bouncing, you're pivoting, you're planting, you're exploding. I mean, I pulled my calf when I was throwing, and it's not comfortable. And he's not a small man either. There's a lot of force on that calf. So hopefully he heals up and he comes back strong.
Yeah, I feel for those type of injuries on any athlete where it's so far away from his throwing arm. What makes him his money, his head and his arm.
Right.
And he's like, I am so frustrated. It's like somebody that goes down with a big toe pain, like on the past. It's like, man, just cut it off. But the calf, that's a killer, man.
Yeah.
That's why they say the Achilles heel, right? You know. So
no, really, if you're not feeling good, your ball's going to say, oh, you can't plant, you can't rotate, you can't, hit that back step. If you're a right-handed guy, your right calf's super important. So it's unfortunate. I was bummed to see him. I didn't get to watch that game, but I saw the report come across, and my first reaction was like, no, and this comes from an AFC Charger fan, and the Bengals are, one of the top teams. Even though they're 0-2, the Chargers are 0-2. Look, I promise you, there's some 2-0 teams that aren't going to make the playoffs. Right. So it doesn't worry me. I know I keep saying I know the Chargers have some, star players, some veteran players, people who don't listen to the outside noise of people who talk about, oh, you're starting off terribly and your season's done. I'm always concerned about the health of any team and the people that I know. And so I'm excited for the new week, hey, flip the page, new week on Tuesday. Let's go. We're going to Minnesota. Let's get our first win.
Agreed. Gotta do that. New chapter.
So to preemptively, I'm just going to answer my question. My game of the week is the 0-2 Vikings versus the 0-2 Chargers in Minnesota in the early slot, 10 a.m. Anyone now? Your Raiders played last week. How'd they do, Dustin?
Yeah, I'm not really talking about the Raiders this year. I'm
Awesome.
yeah, no. So, um, yeah,
It's
uh,
okay. I prefer that as well. I was just trying to be cordial.
yeah, you're trying to be PC and nice, and
Yeah.
no, I no, we were talking about this a couple weeks ago. It's been hard for me to root for them. It's been hard for me to root for I might as well just become a Charger fan because I've never been a Charger fan, and now I got you. I might as well, team up with you, and
Yeah.
maybe I can actually help the team. I don't know.
People ask me all the time, like I was watching the Panthers Saints game earlier today, and the Saints won that game 20-17 versus the Panthers. I saw a couple sacks by Frankie Lou, and he um, just had a couple outstanding plays. If you watch the highlights, maybe it'll be on Sports Center later on today. But people often ask me, like, man, why are you excited about like this game that's on tonight? It's not like your Niner team or the Chargers. And I mean, nowadays I root for players, even players that I don't treat. If I know someone who treats them, perhaps another doctor, or if I know a little bit of a backstory, or even if I don't, just as a fan, I love to root for players almost more than uniforms these days, just with all the movement.
No, I get that. I grew up all Dodger and Ram, hating anything San Francisco Bay Area. But I
Dang.
got guys on San Francisco
And
that
now
I
look at us.
that I've worked with, and I love watching them do their thing. So
Yeah.
yeah, so so I have to put my ego to the side and root for the player, not for the team.
Yeah, no, it's interesting. It's interesting when you have somebody on both sides and you're like,
Yeah.
I want you to do well and you to do well.
Yeah.
But so
Yeah.
it's the fun part of it.
Yes, sir.
Well, anything exciting going on this week with you, appointment wise? Any travel, anything out of the ordinary?
Man, I take it one day at a time. I'm trying to think ahead. Nothing. There's probably something that I'm probably gonna,
Think about later.
yeah, and be like,
Yeah.
oh man, how can I forget that or miss that?
Yeah.
But yeah, no, nothing.
Yeah.
Nothing comes out.
Good, man. We'll have a good week of healing patients, treating patients, breaking down some knowledge to those who are open to it
Yes,
on
sir.
on how to be healthier. And I appreciate you making time tonight. I'm curious to see the games next week. I didn't ask you on air, but I will ask you later about how we did in our picks this week.
Yeah.
And yeah, good thoughts out to Travis Hunter and his injury. Hopefully he recovers quickly, and everybody we talked about. And any final thoughts, Dustin?
No, appreciate you, and I'm looking forward. We talked offline, but we're gonna start bringing some more short podcasts for our listeners during the week. So I want to put that out there, and so stay tuned, everybody.
Yeah, it'll be good. We have a guest in office next week that we're excited about, so that's going to be a good time. We have a lot of good college football games going on this weekend, a lot of top matchups, and yeah, looking forward to watching those. I do see a little bit of a difference in play, obviously, between the college game and the pro game, and I like to see the younger athletes out there. Whether you're a freshman or a sophomore and you're playing in a big game, it's cool to see the excitement. You really see, like, man, this is a big moment for them. So I'm looking forward to watching some of those games this weekend.
Yeah, me too.
Right on, Big D. Well, let's catch up later on in the week. I appreciate the time you made. To our listeners, we always appreciate you. Thank you. Tell a friend if you enjoyed today's episode, share it with them, and we'll try to keep bringing you the latest sports medicine news and hopefully educate and entertain you at the same time. I'm Dr. Dhokal. I'm with my
Dr.
good friend,
Glass.
and we'll be coming back to you guys next week. Thank you guys, Dustin. Have a good week. Be safe, and we'll talk soon.
You too, Bond. Thank you.
All right, bud. We'll talk soon. Good night.
Sounds good. Good night.